Hello everybody, I'm Michael Wilson. Welcome to another video about ARC Texas. What is ARC Texas? Well, ARC stands for Assisting Rural Communities, and we do focus on the state of Texas because that's where we're from. Our goal is to help promote remote healthcare and distance learning for rural Texas. Plus we have other things that we want to work on also, other issues. But today what I want to talk about is the state of rural healthcare in Texas. Now, if you've ever been to the state of Texas, you know it's big. Now, when we look at a map of the state of Texas, now these are all from the Texas Department of Agriculture in 2018. These green counties, these are considered rural counties. And you can see there's a significant portion of our state that is green. I mean, that's what it is. They are rural counties. Now, in the rural counties, Texas is estimated to have, by the Census Department, about 28 million people, a little bit over that. And about 18% of the population lives in these rural counties, these rural areas. So that means about 5 million people live outside of a major urban area. And when we look at the county breakdowns, the numbers are even more staggering when we figured that out of the 254 counties, 177 of them are considered rural. Now that breaks down to about 70% of Texas counties are rural counties. But what does that mean in terms of healthcare? Well, essentially, when we talk about rural counties without a hospital, we have 177 rural counties. 64 of them don't have a hospital. That's a little bit over 36%. They just don't have a hospital. And again, that's courtesy of the Texas Department of Agriculture 2018. So let's say we look at some more healthcare facts. 25 counties have no primary care physician. That's right. No primary care physician. It's 35 miles between critical access hospitals. And if you've ever been in rural Texas, you know that 35 miles can be over hills, can be out in the desert. It's not exactly on the interstate. Some Texans drive more than 100 miles to the nearest hospital. Can you imagine if you woke up in the middle of the night and your child needed to go to the doctor, had an emergency room, and you had to drive 100 miles to the nearest hospital, the burden that's going to put on you? And also, 50% of future doctors who leave Texas for training do not return. In other words, they leave, they go get their education, and they don't come back to help. Even though a lot of them will have received their undergraduate work, their primary education here in the state of Texas, they don't come back to give back to the state. So now if you live in a rural community and you suddenly find out your hospital is closing, what can you do? Well, there are steps that rural Texas communities can take. First of all, conversion to alternative organizations, freestanding emergency rooms, emergency department with an infirmary, a primary care clinic, not a hospital, but just a clinic. Telemedicine, this is big. This is why we need broadband, which we've talked about and we're going to talk about more. Primary care, follow-up care can give you 24/7 coverage so that you can get in touch with a physician. You can get in touch with somebody who can give you advice on who, what, why, when, and where that you need to do for your child. Or pharmacy, commercial pharmacies, independent pharmacies, those are big, and quick pharmacies. Because a pharmacist in a lot of communities is very highly trained. They have to be in order to be licensed. So they're going to know about medicines, their interactions, and so on. They're going to be very well equipped to help. Community health workers, they can help with transportation, make sure people do get to the doctor. They can obtain the appropriate referrals. I don't know who to call sometimes, but I know that a healthcare worker does, and they can assist in acquiring appointments. If I need an appointment, but again, I don't know who to talk to, I can go to one of them and maybe get that help. And also mid-level providers, physician's assistants, nurse practitioners. These are people who've been trained. These are people who can help and can help provide health care in rural communities, which is something we desperately need. So now, if you want more information on the state of rural health care in Texas, visit the Texas Medical Association's website. It's www.texmed.org, texmed.org. And if you want more information on rural health information in general, go to ruralhealthinfo.org and /state/Texas. And you can get all the information you need from right there. It's a very important thing that we need to deal with. We need to work on establishing better lines of communication, more healthcare avenues for people who live in rural Texas. Now, I'd like to invite you to join us for our grand kickoff. That's right, our grand unveiling, because we're really not going to be unveiling our company until September. We're just doing this now to lay the framework, lay the groundwork for you. So come on down, Labor Day weekend, August 31st through September 2nd, at the Henry B. Gonzalez Convention Center in beautiful downtown San Antonio, Texas. It's going to be during the International San Japan 11 Magical Universe Anime Convention. Why there? Because we're also going to be introducing a line of games that we are working on that are designed to help promote rural Texas and rural Texas communities. So I am Michael Wilson. This is ARC Texas, where we're trying to promote remote healthcare and distance learning for rural Texas. Thank you very much for your time.